268 days since the pandemic started now, and we're starting to see familiar and troubling case patterns emerge, both here and abroad. This as the death toll in the U.S. tops 200,000, the highest in the world. Meg Terrell is here with the very latest. What do we know, Meg?
Hey, Kelly. Well, let's take a look at Europe to start. They are in the midst of what looks like a second wave. If you take a look at the new daily case counts in countries like Spain, France, and the UK, you can see they are steadily ticking up. And the UK, of course, today implementing new measures, encouraging folks who can work from home to do so, closing bars and restaurants earlier. This as we are starting to see cases ticking up in the United States now as well. And if this trend continues, this would be the country's third wave in terms of daily case counts. 13 states now are seeing more than 25% growth in new daily cases week over week. Those are the dark yellow states there, primarily in the middle of the country. Dr. Fauci today telling CNN that we need to get cases much lower before October, November, and December. Here's why.
If we don't get that baseline down sharply to a very low level, and the reason we need it there is because when you have a very low baseline and you start to get the blips, as I call them, you don't want them to turn into surges or rebounds. And when you have a lot of cases floating around, it's much more difficult to contain that.
But Kelly, of course, the trends are going in the wrong direction for a number of states, which are hitting new peaks in daily new case counts. 3 states here, Minnesota, Utah, and Wisconsin, all seeing more than 50% growth in their 7-day average of new daily case counts. So we need to return to the things we've been told to do this entire time: distancing, masks, hygiene, all of those things they say work. We just need to implement them in time to try to make a dent in this before fall, Kelly.
And is there anything we've learned from Europe in that regard, or even as we watch the UK, try to figure out what they can do to slow the same thing from happening here?
Yeah, well, if you look at these kinds of restrictions they're putting in place, it's clearly the places where people are gathering indoors: restaurants, bars, workplaces. We know that being inside is more dangerous than being outside in terms of the spread of this disease. And so trying to curb that activity as much as possible is what people are trying to do. But that gets harder as it gets colder and we can't do as much outside. So that's the main concern.